We have reported a positive case or positive cases of cholera in Bomet County. So ours is to urge our people that they need to take care of their hygiene. We need to have cleanliness in where we are, starting from our homes and even in institutions where we attend. We got this report on 21st, and this was a 7-year-old girl who developed diarrhea, and upon being admitted in a facility in Bomet County, we were told cholera is positive both by rapid diagnostic testing and the culture. So we have since gotten another 3. These are from around Bomet town. One is in a place called Cheswerta, which is in Kapsimotwo. Another one is in around Tenwek, where the hospital facility is, and the third one is around Kyogong. We are yet to establish the residence of the 4th case, but when we establish, we will announce to our teams so that they go and do contact tracing, first of all by line listing, and then doing the necessary to the families that might be exposed. We want to urge our people that the measures that are taken after a cholera outbreak may be very painful, because we will have to suspend some of the economic activities that our people depend on, and that will be for a short time, especially if people collaborate, people accept that we need to do this because of issues of prevention of transmission. So hawking, especially selling things in the open, mostly around those areas where we've announced that the initial cases were identified. We suspect that some of the fruits that are brought from far, we know how people handle fruits when they reach the market. They are poured on the ground, people trample on them, they pick the good ones, they leave the others. So we will be enhancing our vigilance, especially on the suppliers of this, because we want to ensure that they handle these things in a clean way. We will be collaborating, and we have talked to other stakeholders, especially the national government through the county commissioner, and our governor has been briefed adequately, and he has given us an okay to do all that is necessary. So we'll be collaborating with even our other departments in the county government of Bomet, water department, education, administration, and even health, so that we approach this thing in a multi-sectoral manner. We've also appealed to Kenya Red Cross and Dig Deep and even World Vision, who are people who have been working with us. Those are teams working with us in water and sanitation areas in Bomet County. So we are appealing that let us take these measures as proposed by public health so that we can contain this problem. One of the first measures we did was to go and inspect the schools where these kids were. In fact, the first child was in a school, an academy. We've since inspected the academy. There is no other case from the school. We've also looked at the areas where they get the water supply, and we've taken measures. Even for the community around there, we'll be educating them on where they should be getting their water. The other school where the younger girl of a 3-year-old in Tenwek was in a daycare center, we are proposing we've closed the daycare center for some time as we monitor if there is any other child that develops that. We didn't want the children to mingle, knowing that this problem started there. We've also asked education to help us. We will be asking education to help us, especially for boarding schools around these areas, that they get water from the water supply in Bomet County, because we know there is a shortage of water, and that can be a problem. We are going to ban hawking in those areas, especially Bomet, Silibwet, and Kapsimotwo, and along the routes that connect those towns. We will even include the neighboring facilities, because you know kapkwen on Tuesdays there's a congestion of people because of the market. So we'll be including that as a precautionary measure, so that we don't this thing may not escalate.